Okay, in this video, I want to teach you how to take your blood pressure at home. Everybody should have the ability to take their blood pressure at home. If you don't, or if it's too complicated, most of your local pharmacies, a lot of major retailers like Meijer and Walmart have blood pressure stations, and it's a good idea to keep a close eye on your blood pressure because it can change at any time and it will change all the time. Everything will change it depending on if you're hydrated, if you're stressed, all kinds of things. So don't ever expect that if you got a reading of 120 over 80 one day, you can take it in the next 20 minutes is probably going to be a little bit different. And that's okay. We just start worrying when that blood pressure is over 130 over 80 all the time. That's when you're diagnosed with high blood pressure. But if it's just going up because you're temporarily, like if you're stressed, if you've had a high salt food content, it's going to go up a little bit. As long as it's coming back down, that's okay. But it's a good idea to always keep an eye on it. So how do you do this? Every home needs to have one of these. This is your home blood pressure cuff. You can get these anywhere at any retail store, any pharmacy. You can get it on Amazon, wherever. Let me show you how to use these because I have a lot of patients that purchase these and then they don't know how to actually use it. And if you don't put this on correctly, you're going to get inaccurate readings. Also, make sure that you're getting one that goes around the forearm and not around the wrist or the hand. These are not as accurate down here. So you're going to get a cuff. It comes like this, and this part is the confusing part because there's a lot of Velcro on here. You see this says okay, and with the arrow this way. And then see this little thing? Almost all of them have this little thing. That stands for artery. You want this right here to be above your artery. Your artery is right here. It goes right down your arm like this. You can feel it. If you put your finger right there, you can feel a pulse right there. Go to where your pinky is, kind of go straight up. You'll be able to feel that pulse. That's what you're measuring. So what you do, you're going to, this is a circle like so. You have this tag this way. This, let me show you. If your blood pressure cuff comes open like this, and it might when you first get it, this part with the pictures or whatever on it go inside. You flip this over. This goes through the metal piece like so. Like so. If you have arthritis or something, this might be a little bit tricky to do. Pull it through here. Pull it nice and flat so that this is through. It slides through like this. Then what you do is you find this little thing that says artery. Slide your arm in it and see how I've got this artery thing right in line with where this artery is. This will tell you okay on this side. You want that there. And then what you do is you take your cuff, flip it until you get your artery thing in the right spot, and then bring it around. And you want it tight enough, but not super tight. So the way, and I pull it until it's a little bit tight, and then you just close the Velcro like so. Now, if you have a bigger arm, they make these for larger people. So just get an extra large size so that this fits all the way around because you want the Velcro tight enough that it's not going to fall off when you start pumping up the pressure. So now you've got your blood pressure cuff on the arm correctly. You should be able to get 2 fingers underneath it. It should be about that snug, but not falling off and not really moving. So it kind of fits like that. Then all you have to do is you're going to push your button. It will automatically inflate. See how this says SYS? That's systolic. That's the top number I told you about. DIA stands for diastolic. You need to have your arms at heart level. Your bladder should be empty. Your feet should be on the ground. So then, after the blood pressure cuff has blown up, it will automatically release on your arm and it will give you a reading. So my pressure right now is 109 over 73, which is fantastic. The systolic, this top number, might be a little bit low, but I'm not having symptoms. I'm not lightheaded or dizzy, so that's okay. I usually run just slightly low like that. This bottom number that you get here, 84, is your heart rate. So that's also important to know what your heart rate is. So this is how you take your blood pressure. Then you just simply turn it off. Now there's a bunch of different models. Unstrap it from here. And then I think it's easiest to leave the Velcro kind of attached so you don't have to do that little process where you pull it through that metal part a lot. And you just take your arm out. And then next time you just can take it in, open it up, and repeat that process. Another thing that's important for everybody to have in their home is a pulse oximeter. Now, this became everybody's friend during COVID because everybody's oxygens were getting low. We needed to know exactly what the oxygen levels were doing. This little guy is fantastic, and it's super easy. They're also very inexpensive at pharmacies or Amazon or wherever you shop. You just open it up. This is rubber in there. It's nice and soft. You put your finger in like so, press the little button like so, and then you wait a second. And then you'll also get a reading here. And what this is telling you, this top number here is your oxygen level. That's 99. And it should be higher than 95, really. When it starts getting down 94, 93, we start getting a little bit nervous. It's definitely nervous if you're down near 90 or lower. We'll talk about that when we talk about lung conditions. And then this one is your heart rate. So this one is saying that my heart rate is 93. I probably had a little bit too much caffeine this morning. Anyways, both of these equipment are very important for everybody to have in your home because it's important to manage your own health care and know what your health is doing at any time.